Welcome to the Urology Health Minute. Do you ever leak when you cough, sneeze, laugh, lift something heavy, or exercise? If so, you are not alone, and it is not something you should feel embarrassed about. This type of leakage is commonly called stress urinary incontinence. The word stress, though, does not mean emotional stress. It actually means physical pressure on the bladder. When pressure increases suddenly, such as during a cough, sneeze, laugh, or lifting, the pelvic floor muscle support system may not be strong enough or coordinated enough to keep urine from leaking. One helpful strategy is learning to activate the pelvic floor muscles before pressure happens. Try gently squeezing and lifting the pelvic floor muscles before you cough, sneeze, or lift. This timing technique is called the Knack. At Urology Health, we help patients understand what type of leakage they have and guide them through practical, evidence based steps to improve bladder control.